This is Talk the Home of Common Sense with me, Julia Hartley-Brewer. Philip Ingram, a former military intelligence officer, also still with me. Let's talk right now about the NHS, often in the news, but also those creeping up, I mean, absolutely jumping up benefits claimants that we are seeing. Almost 4 million people now of working age are claiming some sort of disability or incapacity benefit. 1 in 10 people of working age, that is. And claims by the under 40s, new claims by them, have shot up by 150% in the last few years. Well, one man who thinks that he's got the answer to a lot of our problems when it comes to our health is Dr. Kristian Niemietz. He's author of a new report about the NHS and is editorial director at the Institute of Economic Affairs, the free market think tank. Good morning to you, Kristian.
Good morning.
Thank you so much for joining us. Now, you've got a new paper out about the NHS, and basically you think the answer is to replace the NHS, and we will get to that in just a few moments. But this is one of the key reasons why people are now finally debating the future of our healthcare and our funding for our healthcare in this country, is because the costs just keep going up and up and up. So many people on waiting lists, people can't get doctor's appointments, people literally dying even when they've got to A&E because they're not being treated. But we've also got this huge benefit cost of people who aren't in hospital, who aren't with the GP, but are claiming benefits for disabilities, incapacity, often mental health claims, and they are in their millions. And the latest figures show that we have seen a huge jump, particularly from young people in this country, of claims of this sort, many of them for anxiety, depression, other mental health issues. And although we expect that these things would go up after the lockdown and COVID and experience people had, they have gone up far more in this country than any other. What do you think's behind that?
Well, yeah, I mean, that is really the anomaly here. The Institute for Fiscal Studies had a report out on this as well. They also say we don't see this increase elsewhere. And even though all the reasons you could come up with, the pandemic itself and the lockdown, that's happened pretty much everywhere. That is not specifically a British anomaly. What has happened here to a greater degree than elsewhere is that the waiting times have shot up to far higher levels, and they haven't come down again.
Yeah.
Now, I don't know to what extent these two phenomena are connected, but I would be surprised if one had nothing to do with the other.
Yeah, absolutely. And there's also, for many, many years, it was backache. That was the reason why people got signed off work for months, sometimes years at a time. And then it became stress. And now it's anxiety. It's various other different mental health disorders. But the thing is, I mean, these things change over the years. But the key thing that all of these have in common is there's really no way for anyone else objectively to say whether you have got a bad back or whether you have got anxiety or not. That is something that is basically a subjective thing that cannot be tested, which is quite convenient, isn't it?
Yes, that's one of the problems here. And I'm guessing if you are a benefit advisor or if you are in charge of approving or declining applications for benefits, then, well, if somebody is on a waiting list for a treatment, that would make it harder for you to say, well, you probably shouldn't be entitled to this. Yeah,
indeed, and that makes it so difficult. What's the solution on that front?
Well, I mean, I don't have a solution to this problem specifically. I've just been saying for years, if you compare health outcomes here to health outcomes in many of the neighboring countries that use a different healthcare model, outcomes here are consistently behind. And that's not a new phenomenon. This isn't something that only emerged after the pandemic. That has been true for as long as we have data on this. That was true in the previous decades, was true in the 1990s. So why not have the kind of system that they have? And I've specifically looked at how would you manage the transition, because it's one thing to say, oh well, they have better outcomes in the Netherlands, they have better outcomes in Switzerland.
Let's move to their system. Yeah, this is almost like the point at which we're driving on the left of the road and now we're all going to drive on the right. It's not something you can do very, very easy without a big transition. But this is it. This is your new paper. And this is something the Institute of Economic Affairs has been arguing for a very long time in numerous papers. I've read so many of your papers on this, reports on this. But I mean, at least we're now at a point when even those in the Labour Party, even the new Labour Health Secretary, Wes Streeting, accepts, and the Keir Starmer, that there needs to be reform of the NHS. But I think you think that reforming it's not enough. You say it does need to be replaced, and you want what is effectively the social health insurance system that, by the way, pretty much every other functioning Western nation has.
There are plenty of examples of that, and perhaps more interestingly, there are examples of countries that have introduced this quite late in the day. So one of the criticisms that I've often come across over the years that I've been writing on this is some critics would say, well, that sounds all well and good. Maybe if we could wave a magic wand and will that system into existence, that would be great. But once you have a nationalized healthcare service, you are just stuck with it. There's nothing you can do. And I've just looked at the experience of places that have switched from one kind of system to another. The Czech Republic, Slovakia, they've done that in the 1990s. They inherited NHS-like systems from the socialist period, and they did replace that with a more pluralistic market-based system. So it can be done.
And they improved their healthcare, no doubt. So, I mean,
yes.
I suppose at least, again, say we're having the debate about people no longer walking around. No one sane is walking around saying the NHS is the envy of the world. Anyone who says that, frankly, has clearly never left Britain, because you just have to look at the stats to know that is simply not the case. But why do you think so many people, including politicians, including so many working in the NHS, are so wedded to it, when we're constantly told the biggest threat to the NHS is all these doctors and nurses who want to leave to go and work abroad, not in the NHS, where they can get higher pay, better conditions and better health outcomes, by the way, in systems that aren't replicating the NHS. I mean, that's the irony.
I think a lot of them are just not making that connection. I guess it would help if, say, if we stayed in contact with doctors and nurses that have left for a different system, say Australia, that there's quite a lot of medical immigration to Australia going on. And if you then ask them to report back, but I think a lot of them just don't make that connection. They just realize, okay, my pay, my working conditions are better here. But they wouldn't link that to the overall system. They would see that as something that just somehow happens.
Yeah, I know. It's quite bizarre, isn't it? Dr. Kristian Niemietz, thank you very much indeed for joining us. Also, a brand new report saying it's not reforming the NHS, it's replacing the NHS, and how that would save lives. And he's at the Institute of Economic Affairs. Philip Ingram is still with me. I mean, the sacred cow of the NHS means you can't have a sensible conversation. It is the case where actually pretty much only the Labour Party can reform it, because everyone would just scream like, oh, the Tories are going to privatise the NHS. I don't think most sensible people, certainly anyone who's had dealing with the NHS in recent years, could really care how it's funded, as long as they get the care they need quickly.
Well, exactly. People confuse what the NHS is there for. They think it's all about hospitals and jobs. It's not. It's about care free at the point of need for everyone, so that you don't have to pay for it. It shouldn't matter what colour of uniform people have.
But again, it's not, because free at the point of need, but it's not free. I mean, you know, we all pay for it, and as long as we make sure that people who can't afford to pay are covered.
Yes.
And I don't think people realise how much their taxes goes towards the NHS. Yeah. They say, well, I can't afford private healthcare insurance. Well, you probably could if you weren't paying. Yeah, and indeed, it is one of the most frustrating things in this country, that sacred cow.